I get asked all the time when it comes to stem cell therapy, where do stem cells actually come from? Because this one question can tell you a lot about the treatment you're being offered. First, we have bone marrow derived cells. These come from your own body, usually from the hip area. The upside, they've been studied for decades and are very well understood. The downside, it's more invasive process. The number of cells you can collect can vary depending on your age and your health. If you could think about it, these are coming from your own body, so those cells are as old as you are. PRP, platelet-rich plasma, is when the provider draws blood from your vein and spins it down to get the plasma. These have been used for decades for joint injections. The downside, multiple injections are needed. They can be painful, and again, those cells are old as you are. Their regeneration ability may be limited based on your age and health. Next is fat tissue, also called adipose-derived cells. These also usually come from your own body. The fat tends to contain a higher concentration of regenerative cells compared to bone marrow. The trade-off, it still requires a procedure to collect the tissue, and the way those cells are processed really matters. But this is the wave of the future, and there are a lot of clinics studying it. They are also collecting adipose tissue for banking for future medical use. Another source you may hear about is umbilical and placental cord tissue. These cells are donated after a healthy birth, so no harm to mom or baby, and they're known for being very young and biologically active. These are donor cells, not your own, which means they fall under stricter rules and should come from a highly regulated lab. A similar product is the Wharton's jelly from the cord. These tissues are rich in growth factors and signaling molecules that help with inflammation. But here's the key. Not all products labeled this way usually contain live stem cells, so transparency from the provider is critical. Here's why all of this matters. Different stem cell sources with different risks and benefits and different levels of scientific research behind them. There's no one-size-fits-all option. Your provider should be offering you multiple options. The best source depends on your condition, your goals, and how your product is handled and tested. So if you're considering stem cell therapy, always ask, where did the cells come from? And a trustworthy provider wouldn't hesitate to explain it clearly, because informed patients make better decisions.